Hi, everyone. I'm Dr. Steve Chee, and today I want to talk about this question of whether or not painful relationship dynamics could be contributing to physical pain. And before we jump into answering this question, a quick disclaimer, this video is for informational use only. Please get guidance from your medical or mental health professional that can really help um, give you guidance to your unique situation. So I was asked this question by a new patient recently about whether painful relationship dynamics could be contributing to her pain. And just to give you a quick background on her situation, so she's really wanting to have a closer relationship with her son. She was raised in a way that having that type of relationship is really important to her family. And she had also seen firsthand effects of a family member passing before reconciling with one of their children. So she had been reaching out to one of her children and they just weren't responding or responsive. And they had been getting into arguments about it. And really understandably, this was quite upsetting for her. And not to mention, there's been things coming up with her family's estate, like from her husband's passing, that had been driving uh, certain dynamics and interactions more. And of course, worsened by the pandemic. And this really was amplifying over the course of the last 5 months. And the question came up because her pain over the same time frame really has gotten worse. So to answer the question, yes, absolutely, painful relationship dynamics can be contributing to physical pain. And we know that based on research that there's a significant overlap in the brain between the social, emotional pathways and the physical pain pathways. So there's been studies that have found that when you increase social pain, now don't ask me who creates these studies or who volunteers for these studies, but they increase social pain, that increased physical pain. You increased physical pain, that also increased social pain. And there were studies that actually looked at the opposite. So they decreased social pain. And they found that when they felt connected and supported, that it decreased physical pain. And interestingly enough, they did studies where they decreased physical pain. And there was one that I saw where they were using Tylenol, and it actually helped them to decrease their social pain as well. So what she found really helpful and hopeful was just knowing that piece of information, that relieving social pain could also improve her physical pain. And so as I was talking to her, I asked her, was she feeling understood? And she said that she was. So I asked her, how does that feel in her body to be understood? And she said she could feel her whole body relaxing. And to me, this is just a beautiful, brief moment in a series of moments that are important for working with this type of issue. And I thought that you might find this helpful and potentially hopefully uh, hopeful as well for you.